So we're concerned because here in Northern Virginia, we have the type of mosquitoes that could possibly spread Zika virus. It's important to note here, though, that for our local mosquito population to become infected, they need to bite a person with Zika virus. We currently have no local transmission here in Virginia, so a person from our area would have to travel to a Zika-affected area, become infected, and then come back here and not take the appropriate mosquito prevention steps to prevent mosquito bites for 3 weeks upon return. So it's really important to know before you go. Do your research first. Visit the CDC website to see if you're traveling to an area with a travel notice or warning. Zika virus is a viral disease that is primarily transmitted through the bite of an infected mosquito. Once a person's infected with Zika virus, they can also transmit it through sexual contact, or if the person is pregnant and infected with Zika virus, they can pass it to their fetus during pregnancy or around the time of birth. 80% of people who are infected with Zika virus won't have any symptoms, though. So it's important for these 20% of people who become symptomatic to know their symptoms. And the symptoms of Zika virus are fever, rash, joint pain, conjunctivitis or red eyes, a headache, and muscle aches. If you are traveling to an area with active Zika virus transmission, first off, pregnant women should not travel to these areas. It's too high of a risk for them. That's one of the first prevention steps to protect your pregnancy. We know that Zika is a cause of birth defects and other problems during pregnancy. For all other groups, they should pack to prevent. So before they go, they should pack their long sleeves, long pants, insect repellent, and condoms if they plan to have sex. If they're traveling to a Zika-affected area and they're considering becoming pregnant or concerned about sexual transmission, then they should not have sex while there or use condoms consistently the whole time. It's really important to consult with your healthcare provider. They're the best person to talk about if you're concerned about Zika virus and guidance for next steps. Additionally, when you talk to your healthcare provider, you should let them know about your travel history, your sexual partner's travel history, and if you've had any symptoms or recent mosquito bites.
For information about mosquito prevention and mosquito-borne diseases, visit the Health Department's website.